Why does internalized transphobia make safer sex harder for LGBTQ people? Imagine feeling unsure about your own worth or fearing judgment every time you think about your sexuality or gender identity. That's what internalized transphobia is like. It happens when transgender and gender-diverse people absorb society's negative attitudes about their identities. This can lead to feelings of shame, self-hatred, and low confidence. These feelings don't just stay inside. They can affect your mental health, making you feel anxious, depressed, or overwhelmed. When someone feels this way, it can be tough to focus on safe sex practices or even seek out information and resources. Internalized transphobia chips away at your sense of self-acceptance. If you feel ashamed or conflicted about your gender identity, you might find it hard to speak up during sexual encounters. You may struggle to set boundaries or insist on condom use and other safer sex methods. This is because feeling unworthy or afraid of rejection can make it seem easier to avoid discussions about sexual health altogether. Many transgender and gender-diverse people also avoid healthcare settings because they worry about being judged or discriminated against. This means they might skip HIV or sexually transmitted infection testing, or avoid talking to health providers about prevention options like pre-exposure prophylaxis. Without regular testing and access to prevention tools, the risk of HIV and other infections can increase. Mental health challenges linked to internalized transphobia, like depression or anxiety, can also lower motivation to practice safer sex. Some might engage in riskier behaviors as a way to cope with emotional pain or seek validation. These actions can put them at higher risk for HIV and sexually transmitted infections. Low pride in gender identity can make it harder to focus on health and safety. But building pride and self-acceptance can help. When people feel good about who they are, they're more likely to advocate for their needs and practice safer sex. Creating supportive environments where transgender and gender-diverse people can openly discuss their identities and health is key. Combining mental health support with sexual health services helps address internalized transphobia. Providing education that affirms gender identity and promotes self-love encourages safer sex practices. Access to gender-affirming care can also reduce feelings of shame and improve overall well-being. In the end, internalized transphobia creates emotional barriers that make safer sex harder. It can lower self-esteem, increase mental health struggles, and limit access to health services. Tackling these issues with support, affirmation, and education helps empower LGBTQ people to take control of their sexual health and stay safe.